I would rather it.
I've had faculty members that didn't really care about me as a student. Tried to stay as far away from me as they could.
Me too.
And there's reasons for that, but we'll just say they didn't want, they felt intimidated by me as a student.
Yep.
Yeah, they did. I don't know why. I have no idea why, but they stayed as far away from me as they could. And you know, if you do that, you can't learn. I have things that really would help you succeed as a nurse.
Yeah.
We've all been doing this for a lot of time, and we have some things that would help you be successful. Because it's hard becoming a new nurse. And even with the LPN transition, it's not pretty. I've had lots of LPNs I've worked with that have really hard moving from the LPN to RN transition. And it's something that we can help you with. So you need to, and I'm not going to expect you to know everything. I mean, I had a lot of, even as a nurse that's practicing and you change to a new area, you're a novice again. And so when you're looking at things to learn, and believe me, I've learned how to do certain things 6 times now. They keep changing it. And if you don't want to change, you picked the wrong profession to be in. Because now, they used to say everything changed knowledge-wise every 5 years. Now they're saying every 2 years.
Nursing is evolution. And
We hope so, because patients get sicker and we want them to live.
That's right.
Yeah.
And I would have more respect for you if you came to me and said, I don't understand, rather than go and put your hands on somebody and try to do something wrong.
And then,
Or burst into tears holding the NG tube and throw it down on the patient and run out of the room. We will go over it outside the room, go through the steps and everything. Let me know. I need to review this real quick. Yeah, I need to review this real quick.
I expect you to review things before you do, even if you just finished second semester. I really don't care, because how long ago has that been since you've actually done? And some of you probably haven't done any of this. Some of the skills you've not done at all on a real patient. So the best thing to do would be to look at that skill again before you come in, because when you don't do it for a while, it's harder. And I will not tell you that you're doing things wrong in front of the patient, but we'll say, stop, we need to.
Would you like me to get you another pair of gloves? Don't
But
say
some of the
no.
nurses that you may,
Means you broke Sturfield. You need another pair of gloves.
need to revamp.
No?
And I'm just going to say that some of the people, and some of the units, I'm not going to say which unit, they may let a tech help you with a procedure, because some places, different techs can do things they can't do in other places. And again, I don't care where they are, you still have to maintain technique. Because, let's just say the concept of urinary tract infections. Those are usually caused by insertion problems. That's where they usually originate. Now, there is some literature that supports it may also be because you haven't secured the catheter well and it keeps going in and out of the orifice, which again takes infective organisms in every time. That's a part of it, but I think if you go back and really were monitoring as they inserted it, they contaminated the catheter with insertion. So the point is, if you're not maintaining the right technique, and there are some nurses that don't do that, that will be helping you. And so do not learn bad habits. You can come to post-conference and say, well, we had a little problem with that IV going in, she didn't wear gloves. That's one we hear a lot.
Don't pull the finger off the end of your glove.
Because I was raised starting IVs without, and you were too. And
The
you
more
were too.
blood you got on, yeah.
All of us were,
trauma.
because we're old. And we never ever wore gloves to start IVs. That's how we were taught in school. But that isn't the way life is today. So we had to all relearn how to start IVs. Believe me, it was not pleasant. So again, and I think all of you are profoundly evidence-based oriented, because we know that improves outcomes. And we will not fudge on that. People that you're going to work with will sometimes, some of the nurses you're going to be with this semester are not doing it according to evidence. And they're going to poo and paw. Oh, that's just Miss Miller being at the ivory tower. Miss Miller works the same way when she's at the ivory bedside, okay? Because I strongly believe, I have family members that are in the hospital all the time. I've been a member of a hospitalized patients. All of us have. And we want our outcomes to be the best they can be.
Pretty
we
much,
see
we've
all
been on a
kinds of
roll
things.
being the hospital patients lately.
We have all been the hospital patients lately, but we all survived it because we were verbal.
And very, very verbal. And going back to what Miss Miller was saying about, someone, I know, I have addressed this and was,
Reprimanded.
yeah, that's a pretty common occurrence, so. Because, when you have someone who's running the certain program and there's continual falling behind and stuff, and you just call and say, I'm just saying this as an observer, I'm not saying it being employed, not saying it, but we've got some breakdown in communication, and I think it's an education thing, and here's where we're looking at this every week. I've got 10 sets of eyes looking at this every week, and we're seeing this week after week after week after week, and it might be a place that you want to look and see if there's more education needed. Well, who do you think you are? And then you mention IOM and competencies, and what's that? And then when you say, I was just trying to give you a heads up, that's fine. I'm just saying this is what we've observed to make the program better, and trying to keep you from having a sentinel event. Then they listen.
Everybody know what a sentinel event is? Doesn't have to always be death, but it can be a severe injury to the patient. So again, those have to all be reviewed, and they're usually big groups of interdisciplinary reviews because we have to figure out what was the reason for the sentinel event.
And a lot of times they're writing a huge check for it.
Nosocomial infections from UTIs, catheter placed UTIs, the hospital doesn't get paid for that.
Nope, that's why all those never events are not, those are situations where